Good day. Today I will be assessing the thorax and lungs, and also the heart and the central vessels, and the peripheral vascular system. The basic concept of this is assessing the thorax and lungs is a true examination of the respiratory system. The thorax comprises the lungs, rib cages, cartilage, and intercostal muscles, wherein all the four assessment examinations technique will be used. This nursing skills is also recognized and identifies normal and abnormal breath sounds, a crucial components of the lung assessments. And also, assessing the heart and the central vessels is one of the most complex and important aspects of physical examination. These nursing skills utilize the palpation, inspections, and auscultation technique for the assessment of the heart, pulmonary, and coronary and neck arteries. And also, assessing the peripheral vascular system includes measuring the blood pressure, palpating peripheral pulse, and inspecting the skin and the tissues to determine the perfusion to the extremities by Berman 2015. Now I'll be going to proceed in the assemble the equipment. So I have here a stethoscope and also a centimeter ruler and a pencil or skin marker, and also a alcohol for sanitation. So first thing to do with the client is introduce yourself and verify the client's identity. Explain also to the client what you are going to do, what is necessary, and how the clients can cooperate, and perform a hand hygiene and observe other appropriate infections control procedure, and also provide for a client privacy like closing the windows, close the door, and use a curtain. So now I'll be going to introduce myself to the client. Hi ma'am, good day. I am Aubrey Libres, your student nurse for today. And today ma'am, I will be assessing the thorax and the lungs, and also the heart and the central vessels and peripheral vascular to monitor the first procedure for this assessment is to inquire if the client has any history of the following: a family history of illness that include cancer, allergies, tuberculosis, lifestyle habits such as smoking, and occupational hazard. Any medications being taken, that current problems such as swelling, cough, and wheezing and pain. And also, in the second procedure is the posterior thorax. Inspect the shape and the symmetry of the thorax from the posterior and lateral views using the tip measure. Then compare the anterior-posterior diameter to the transverse diameter. Inspect also the spinal alignment. Also, have the client stand from a lateral position. Observe the three normal curvatures, the cervical, thoracic, and the lumbar. To assess for lateral division of the spine, observe the standing client from the rear. Then have the client bend forward in the waist and observe from behind. And then palpate the posterior thorax. For clients who have no respiratory complaints repeatedly assess the temperature and integrity of all chest skin. For clients also who do not have respiratory complaints, palpate all chest areas for bulges, tenderness, or abnormal movement. Avoid deep palpation for painful areas, especially if a fractured rib is suspected. Now I will be going to palpate the posterior thorax for the clients who have no respiratory complaints. So, avoid deep palpation for painful areas, especially if a fractured rib is suspected. And then after that, palpate also the posterior chest for the respiratory exertion. Place the palm of both your hands over the lower thorax with your thumbs adjacent to the spine and your fingers stretched laterally. Ask the client to take deep breath while you observe the movement of your hands and any lag in movement. So ma'am, I will said breath, you will be breath ma'am, ha? So I'll be placing my two hands in the both sides in the lower thorax. Breathe deep. Ma'am, can you breathe? Breathe, ma'am. Breathe, ma'am, please. So now I will be going to palpate the chest for vocal tactile firmitus. Place the palmar surfaces of your fingertips or the ulnar aspects and also of your hand or closed fist on the posterior chest, starting at the near of the apex of the lungs. And then ask the client to repeat such words as blue moon or 1, 2, 3. Repeat the two steps, moving your hands sequentially to the base of the lungs. Also, compare the firmitus on the both lungs and between the apex and the base of each lung. So, ma'am,